again to everybody. I'm Lindsay Crane and I head the content and community teams at Undivided, and we are a support system for families raising kids with disabilities and developmental delays. We offer an extensive library of free resources for everyone on everything from IEPs to inclusion to IHSS. And if you need more personalized one-to-one support, our membership options offer a web and mobile app that makes it easy to store, share, and access your child's IEP and medical records from anywhere. We all know how much paperwork there is, so it's nice to have it in one place. You can create your very own digital super binder with step-by-step guides and checklists, all of your priorities organized in one place. And even better, members receive one-to-one coaching with a parent navigator who helps tie all the resources together in a way that makes sense for each family. They help you organize, prioritize, and mobilize around difficult topics like today's topic, so which can be one of the most frustrating for parents. How do we maximize our health plans so our funding options play nicely with each other? So Medi-Cal, regional centers, CCS, and private insurance, how can we utilize these options so our kids can get what they need? And we wish the answers were all black and white, but as everyone on this call knows, it's not always the reality. So lucky for us, we have two incredible guests who can help us answer some of the most common questions and scenarios around funding options. Undivided's public benefits specialist, Lisa Concoff Kronbeck, and Undivided's director of health plan advocacy, Leslie Lobel. Hello, ladies.
Hello.
Hello. Not only are they professionals in their field, they're also parents of children with disabilities. So they bring with them a long history of professional advocacy and the personal knowledge of how hard that advocacy can be. So before we jump into specifics, Lisa, I'd love for you to give just a quick overview and confirm who is eligible for Medi-Cal, Regional Center, and CCS, so our families know what's actually available to them. So let's start with Medi-Cal. Lisa, who's eligible and what can it provide?
So Medi-Cal is California's Medicaid program. Eligibility is often based on family or household income, but it can also be based on adoption or foster status or disability. There are several programs to give people with disabilities access to Medi-Cal. A lot of children who don't meet the household income requirements may also be eligible through one of several waiver programs. The most common is the Regional Center, the Developmental Disabilities Waiver, which is accessible to Regional Center clients. Yeah, go ahead.
Go ahead. I was going to say, which you might have been about to say, and there are two different types of Medi-Cal, although as of this year, most of our families are really going to fall under that managed care, correct?
Yeah, that was the next thing I was going to say is, traditionally there have been two different types. There's fee for service, which is kind of like a PPO, and managed care, which is basically an HMO. The state has been gradually transitioning everybody into the managed care program with a few very limited exceptions. Most families are going to be enrolling their child in a managed care program.
And how can parents find Medi-Cal providers? We hear that over and over again, like, okay, I want to use it, but how do I find somebody that uses it?
So I'm going to use LA County as an example because we're here in LA County. LA County is a 2-plan county, so there's a private plan, there's a private managed care plan that people can choose, or there's a county run plan, which is so that's HealthNet, which is the private plan. And then there's a county run plan called LA Care. And under LA Care, there are also several plans that they subcontract with, Anthem Blue Cross, Blue Shield Promise, Kaiser. And so if you want to find a provider, you want to go to your managed care plan's website. And so for LA Care, that's lacare.org. And for HealthNet, that's healthnet.com. And at the top of the page, you'll always find a link that says find a doctor or find a provider. And you want to click on that and you should be able to search by county or by specialty. If you're on the HealthNet page, you need to select from the drop-down menu, you need to select State Health Plan Medi-Cal because HealthNet is a private plan. So there's all sorts of different programs you can be on within HealthNet. So you want to make sure that you choose the Medi-Cal program. And under LA Care, you also want to choose Medi-Cal because there's also Medi-Cal Connect, which is with Medicare, and there's also LA Care Covered California. So just make sure that you're in the Medi-Cal section and you should be able to find providers.
And Lisa, just to clarify, does Medi-Cal cover like out-of-network providers?
Generally not. In almost every circumstance, there's always going to be, there's exceptions in limited cases, but very, very limited. For Medi-Cal, a managed care plan to cover an out-of-network provider, Basically that would mean that the managed care plan does not have a provider who offers that type of specialty care. And then in that case, it would have to be through prior authorization. But generally speaking, no, you have to see a provider within your managed care network.
Okay. And for regional center, I'm sure most people on this call, but I never want to assume know what that is. But what is regional center and who qualifies?
Okay. So regional center is a statewide network of agencies that provide services to people with developmental disabilities and people at risk and children under age 3 at risk of developmental delay. So under 3 is early intervention, and that comes through IDEA, through federal law. And so under 3, it's for children who are diagnosed with or at risk of developmental delay. So there's certain diagnoses that automatically qualify, such as like prematurity up to a certain point and certain diagnoses. Otherwise, they're going to look at how delayed they are relative to a typically developing child of the same age. Over age 3, we're talking about the Lanterman Act, which is a California law designed to assist people with diagnosed developmental disabilities who have a substantial disability because of their diagnosis. And the diagnoses that are eligible are cerebral palsy, autism, epilepsy, intellectual disability, and what they call the 5th category, which is diagnoses that are similar to intellectual disability in the way they manifest or the treatment that it's required. And they have to substantial disability means that they have impairments in 3 or more different areas, including communication and learning abilities, self-care, mobility, independent living skills. So there's a variety of different areas that they can look at to see where the deficits are for eligibility.
And lastly, CCS. So this is something a lot of parents are like, what is that? Or they hear somebody talking about it. Who's eligible for CCS?
Okay, so CCS is California Children's Services. It is separate from Medi-Cal. There's plenty of people who have both, but it is a separate program. There is a lot of interaction between the two, but it is a separate program. You can have one without having the other. It is specifically based on medical diagnosis. Intellectual disability or developmental delay is not a disqualifier, but you will not get CCS services based only on those diagnoses. There has to be a medical diagnosis that falls within the CCS criteria. There's a whole long list, and it's all about different medical issues that affect different bodily systems, like the circulatory system or the respiratory system. There are some financial criteria for CCS. However, if you have Medi-Cal, they disregard the financial criteria. If you do not have Medi-Cal, then it's based on family income or the percent of your family income that's taken up by medical costs. And they also run what's called the medical therapy unit, which is run in conjunction with local education agencies to provide school-based therapies that are also medically necessary.
Right. So now let's talk about how all of these can work together on their own, what they cover. So let's take a family who has a private PPO health plan, for example, from a parent's employer, as well as they have Medi-Cal and regional center. So who pays first? Is there a general funding order that parents should understand? Leslie, you want to take this one?
Sure. Lisa, I always love to listen to you explain things that I already know. It's very comforting to hear them again because it's a great reinforcer. So thank you. So yeah, when multiple funding sources are in play, there's a definite order of operations that people need to be aware of and follow. Bottom line, private insurance always pays first. The order of operations becomes private insurance, then Medi-Cal, and finally regional center, once you've exhausted all the other options. Those other options are what regional center calls generic resources. So once you can prove all of those have been tapped, regional center is willing to step in.
And Leslie, does that order depend on circumstances or is that set in stone?
Regional center will always position themselves as payer of last resort. They'll only consider funding once you can prove that you've tapped into all those generic resources. So yeah, that's a pretty set in stone rule of thumb.
Okay. And Lisa, how about CCS? How does that fit in?
So that's fun. CCS, sometimes you don't even know CCS is involved. They kind of sometimes operate in the background. But basically, if a family has CCS and Medi-Cal, CCS kind of does some case management there. So your private insurance always pays first. There's no exception there. Private insurance always pays first. But once CCS is involved, they'll look at the service or equipment or whatever you're requesting, and they'll see if Medi-Cal, if it's something that Medi-Cal covers. If Medi-Cal covers it, they're gonna defer to Medi-Cal to cover it. If it's not something that's covered by Medi-Cal, then it'll go back to CCS, and CCS will assess whether CCS can provide funding. So there's certain equipment, certain treatments that are not just not covered under Medi-Cal, but children still need access to them, and so that's where you're going to go to CCS.
Right. So let's take regional center out of it for a minute. So if a family's chosen provider takes their private insurance and Medi-Cal, can you give an example of where they each would pay a portion of that visit and or services, Leslie?
Yeah, thanks. ABA is a great example here. If your child's ABA provider is in network with your primary health insurance and also contracted with the specific Medi-Cal managed care program in which your child is enrolled, then the provider can balance bill Medi-Cal after your primary pays. So if you're beginning a service, say ABA, and you already have a provider in mind, you should check to see that they're contracted with the specific plan that you have, or you can change your child's enrollment to the managed care that provider accepts. Getting all that aligned is particularly great for a service like ABA, which involves multiple hours a week and month, where costs could really add up. And also it happens to be one of the areas in which lots of providers do accept Medi-Cal for that very reason, because there's so many service hours in any given week or month.
Right. And if you're using both sources of funding, then will you have to pay for anything out of pocket?
Well, okay, so here we go. If in-network and private insurance, if in-network private insurance and Medi-Cal both pay for a specific claim, there's no family expense for that claim. The private insurance will pay, and then Medi-Cal will pay after insurance up to the full dollar amount that they allow for that service. So what does that mean? If the provider is in network with primary insurance and Medi-Cal, they should accept both payments they receive as payments in full, regardless of any balance that's due once Medi-Cal pays up to their maximum. However, if your provider, your primary is out of network, but they do accept the Medi-Cal, the answer on who is going to cover any remaining outstanding copay or deductible is not really as clear, and it sort of depends on who you ask. Families have reported that providers have tried to bill them after receiving payment from both funding sources, and families can sometimes make that billing disappear by filing a grievance with Medi-Cal. But in general, having payment from both sources should alleviate any out of pocket for families.
Okay. So for Lisa, I was going to say, if a family does not have private insurance and Medi-Cal is the child's only insurance, should they have any out of pocket expenses?
Can I jump in and add something really quickly before I answer
Please
that?
do.
Okay. So here's the thing. Traditionally, if people had private insurance, they were not enrolled in a managed care plan. They were enrolled on fee-for-service Medi-Cal as secondary. Right. And as of this year, as of January 1st, so just a few weeks ago, all of the families whose children had private insurance were required to enroll in a managed care plan. So this is very new. Managed care plans, a lot of them are not accustomed to dealing with families who have private insurance. And so as we have been making inquiries and asking questions, we have been getting different answers from different people. We've been getting different answers from different plans. So there may be a few road bumps as the plans get used to dealing with coordination of benefits with private plans. So I just wanted to add that's why there's that uncertainty, is because this is something that's brand new.
Thank you.
Okay, so to answer your question, Lindsay,
Yeah.
If Medi-Cal is the only insurance, should they have any out-of-pocket expenses? That depends on whether all of the services were things that are covered by Medi-Cal. So for example, if you are ordering a wheelchair for your child, Medi-Cal has authorized the wheelchair, but you have also ordered something, an accessory on the wheelchair. Maybe you've ordered decorative spokes or a cup holder or something like that. Those are convenience and cosmetic items, and you may be able to pay out of pocket for those, but those are not going to be covered by Medi-Cal. So in that case, if there is something that was not a Medi-Cal provided service, you may see an out-of-pocket expense. But as long as it is something that Medi-Cal covers, you should not see additional out-of-pocket expenses, because when the provider agrees to accept Medi-Cal, and this is true even if you have private insurance, whether you don't have private insurance, when a provider agrees to accept Medi-Cal, they're agreeing to accept the Medi-Cal contracted rate, even if that service costs more to provide. So they should not be billing the parent for any additional services after Medi-Cal has paid.
Right. Unlike private insurance, like
And the provider would let you know if you're ordering something that's
Yes.
off the menu. That
Yes.
shouldn't be a surprise to you.
Yeah, you should discuss that ahead of time.
Well, that was actually going to be my next question, Lisa. I mean, if a child's Medi-Cal doctor prescribes a therapy, a specialist, medication, supplies, anything like that, does that mean that it's automatically approved?
No, and you so it's really
important.
important.
That surprises, or in an answer that surprises no one. No.
So it's really important, especially because a lot of doctors are not used to dealing with Medi-Cal. They're like, oh, if I prescribe this thing, the insurance will cover it. They really need to make sure that they're documenting medical necessity, why they need this item. For most things like that, a prior authorization is going to be required. In some cases, generally not with therapies, but like if you're requesting a piece of expensive equipment, a wheelchair or a toileting chair, something like that, Medi-Cal may come back and say, well, have you tried this? Have you tried this? Why does it have to be this thing? Why have you not? Give us a list of everything you've tried. And like, for example, with the toileting chair, that's a personal example. For my daughter, they came back and said, well, why can't she use this? Why does it need to be this particular thing? And you really want to make sure that the doctors are documenting why they're asking for something, why it's medically necessary. But if you can demonstrate medical necessity, then it should be covered. It's just generally a matter of making sure that it's established why your child needs that service or that item.
Which sounds similar, Leslie, I assume, but private insurance works similarly?
Well, there's a range. So it depends on what your plan is and what the service is. It may be that your health plan only wants a prescription, that you're seeking therapy for which there's an unlimited benefit for the plan year. Or you may have a plan, even an HMO, even a PPO, where pre-authorization for certain items or certain labs or whatever the item may be, where a pre-auth is required either before any services can be accessed, or sometimes the need for a pre-auth kicks in the middle of the year. You reach a set cap of 30 sessions or this many visits. The best thing that families can do is either go to their health plan's website and look for a summary of benefits, or it may require, the dreaded call to the customer service number on the back of your card. But definitely before you embark, you want to figure out what your plan requires for this. They may require nothing for that, but for this, there's a definite pre-auth requirement. And it's pretty easy usually to find on the website.
And that can even be the case with medications or with specific equipment. Any insurance might have a formulary, and they're like, these are the things that we will automatically cover. If you want to go outside of this, you need to establish why you need to go outside of this.
Also imaging, an x-ray may be a slam dunk, an MRI or something that's needed may require a pre-auth, but a network provider will have access to that information, and out of network, you'd be the one looking for the information.
So I wanted to ask, we definitely receive some questions and regularly have questions about gap coverage. So what happens if a child qualifies for a therapy say OT, occupational therapy, but the family's choice of provider has a 6-month waiting list. I'm sure all the parents in here, we all understand that unfortunate reality. So if the child is also a regional center client, can the family get gap coverage, Lisa, while they're waiting?
Okay. So there's a couple different approaches that you can try here. And we're going to start seeing this a lot with ABA because of this transition into managed care, is you can approach your managed care plan and ask if they will contract with your chosen provider because their provider has a wait list. You can also approach the regional center. The regional center may be willing to cover if it's a service that's listed in the IPP only while your child is on the wait list. So they'll be very specific. They're not going to just cover that because there's just indefinitely. But as long as there's a wait list, they may be able to cover those services as gap coverage until your child comes off the wait list, and then they would be expected to transition in.
Okay. And then if they said no, right, though, but if they said, yeah, we're not going to cover, then you can just look for another Medi-Cal provider while
You could look, well, so managed care plans often have a limited number of agencies that they contract with. And that's why you might want to try asking your managed care plan, because they don't have an available provider to contract with another agency, even if it's just temporarily until there's room on their preferred provider wait list.
Right. Well, I'm sorry.
But they really shouldn't. I mean, if it's a service that is authorized that's listed in the IPP as something the child needs, the regional center, I mean, if the regional center says no, I would want to know why they're saying no. And you may be in a position to file an appeal. But yeah, it would really depend on the circumstances.
Leslie, just as a follow-up for private insurance, if that same family's insurance will only cover a certain number of PT sessions in a year, and then the family finds themselves without PT, can they go to regional center and ask for PT sessions until the next year when insurance is going to pay again?
Right. That's a great question. So regional centers should pay if you've exhausted all options within your plan and you have it in writing that no more benefits are available for that plan year. Your plan year may or may not be the calendar year, but for that plan period, there's no more benefits. You have it in writing. Regional center should step in. But I see a hand, Lisa.
So that's for under 3. And for over 3, we're talking about Medi-Cal. Medi-Cal should step in if your private plan has, but yeah, if you're under 3 and your plan has, because for early intervention, the regional center pays for OT, PT, and speech.
When generic resources are exhausted. Right.
And so if your plan only includes a certain number of visits, then yeah, the regional center should step in after that.
Right.
For over 3, you may still be able to get those services through Medi-Cal, because the regional center is going to say the school district is responsible at this point. But you should still be able to get those services from Medi-Cal. But again, Medi-Cal is going to want to see that you've exhausted your private insurance first.
Right. And just a one fine-tuned point on that, regional center will cover if you're under 3, your child's under 3, and if the services are denied by the plan for the specific reason that there's no more benefits left of the year. If the services are denied for some other reason, a claim wasn't correctly submitted, or you filed late, that's not of interest to regional center. It has to be demonstrated that the plan has maxed out benefits for that plan year.
So if they're denying you for, well, this isn't medically necessary, or all of the different reasons we see denials, that doesn't matter. It's only if the plan is reached.
If they're denying because it's not, if they're denying any service because it's not medically necessary, that may be worth, number 1, filing a grievance with your insurance. Number 2, still approaching Medi-Cal, because the insurance might have a different definition of medical necessity than Medi-Cal has, or than regional center has. So you may want to get a copy of your policy and see what medical necessity means, because for certain services, for example, in-home nursing, the insurance may have a completely different definition of what medical necessity means compared to what Medi-Cal says.
I can attest to that personally. Like, that's happened with my daughter, where Leslie knows well, where we've had to appeal for things that are actually best standard practices for testing that is denied by insurance that Medi-Cal has picked up that would
Yes.
otherwise be thousands of dollars that our doctors are saying this is absolutely necessary. So just as exhausting as it is, try to hit all, you never know, right? When you know, just to assume that everyone's going to say no, if you know, to get up the energy to go and really try. And that's really what today is about, to really try to access these resources so your kids can get what they need.
And sometimes the answer is going to be no, but don't be afraid to not take the first no as the final no.
Right. And also show up with at your first request, try to plug all the holes and exclude all the no's you might get. Have the documentation, have the letter, show that you filed an appeal with your plan before you go to regional center. Have that there so, you know, they put down their stop sign. Have all your ducks in a row.
Right. So for gaps, what is typical minimum that Harbor Regional Center or Medi-Cal will cover? Like 3-week wait list versus 3 months?
I don't know that there is a hard like threshold for that. I think it's more for 3 weeks, it's not going to happen because by the time they set up and find you a therapist at the regional center, they'll be off the wait list. I would say a few months. I would say if it's like 2 to 3 months minimum wait list. And I mean, to be honest, a lot of the places in the South Bay do have fairly significant wait lists right now. And so I haven't come across anyone who has a 3-week wait list. I would love to see that. But yeah, you're talking more about like a couple months or more. I mean, like I said, that's not an unusual thing to see. But the regional center contracts, the regional center contracts with a broader range of therapists. They contract with some private therapists, with different agencies, so they may have more access to a greater number of providers to potentially provide services in the meantime. There's no guarantee though, because especially right now, post-COVID, there's just a nationwide shortage of certain providers. So you may find that the regional center also takes a minute to find a provider. But they may still have more access to more providers.
Yeah. I think that shortage definitely spans, wider than South Bay. It's everywhere. But then how does CCS play in? I mean, talking about trying to find, how do they play into OT and PT?
Okay. So like I said before, aside from covering specific therapies that are medically necessary, like at clinic providers, they have a program that they do in conjunction with local education agencies, whether that's the SELPA or a specific school district. They generally have a clinic that is on site at a school, and they provide, like, if in the IEP there are PT or OT services, and this is generally for children who have musculoskeletal conditions, cerebral palsy, muscular dystrophy. They provide physical therapy that is both academically and medically necessary, and they provide it in the school setting, but in a clinic on site.
Okay.
And that is generally, that is not something that's income based. So that is one of the ways that people can access CCS that's not based on income.
Absolutely.
Now, if you need specialized equipment under CCS, that there may be an income test for that through the medical therapy unit. But again, if you have Medi-Cal, then that's a moot point.
And that MTU may be at your child's school site, their specific school building, or maybe
it's doubtful unless your child is at a specific campus that specializes in kids with significant orthopedic impairments. It'll generally be in the same school district, but maybe not
a different site.
Frequently not.
Let's just put it this way: if it's LAUSD, it's probably going to be on an LAUSD campus. If it's a small district, then it will probably be outside of the district or at a SELPA site. And the SELPA is kind of like an umbrella organization of all the local school districts. If there's a bunch of small school districts. But yeah, if you have a small school district, it may not be even in your district, but it shouldn't be far.
Right.
Yeah.
Another common situation that we hear about is when families change insurance and they want to retain the same provider. Of course, we know how hard it is to find good providers. So can you, Leslie, can you explain what continuity of care means and how families can utilize it? Why is it important?
So actually, continuity of care is not exactly what you want if you want to keep your provider long-term. Continuity of care the health plans mean a short-term exception, 60 or 90 days, to allow you to stay with your current provider until you can transition to someone in the new health plans network. So in effect, what you're doing is you're agreeing to transfer service. You're just saying not exactly right now. If what you want to do instead, if you want to stay with your current provider longer term, is to ask instead for what's called an access to care exception by proving, if you can, that there's no one in the new health plans network that is available and qualified to deliver the specific therapy that your child needs. Not that you prefer your current provider, but that there is absolutely no one in the new plan who can give your child what is medically necessary and they're entitled to. That can be an easy thing to do, or it can be a high bar, but continuity of care is not quite the right thing to ask for if you want to stay with your current provider for the entire year. You're agreeing to transfer. Access to care is your ticket.
Lisa, is there anything that we didn't cover before that you wanted to touch on for public benefits?
So that's primarily for a private plan. For Medi-Cal, the continuity of care is at least for this transition into managed care, it's a specific term of art an agreement that you can get for up to 12 months if you have private insurance and you had fee-for-service as your secondary Medi-Cal, and you were seeing a provider through fee-for-service, and you are now being forced to enroll in a managed care plan. This is a very specific scenario. You are now being forced to enroll in a managed care plan, and you want to keep seeing that fee-for-service provider, but that person or that clinic or that provider does not participate in any of your county's managed care plans. You can ask the managed care plan for a continuity, if the provider is willing. A continuity of care agreement is an agreement for up to 12 months that allows the managed care plan to agree to pay the provider at either at the higher of the fee-for-service rate or whatever the managed care plan's contracted rate is for that service. Again, access to care, if the managed care plan just doesn't have that specialty at all, then access to care. But if they do have that specialty, they are eventually going to expect you to transition into a managed care plan provider. But you can get up to 12 months through a continuity of care agreement. Now, I would argue with the managed care plan potentially for certain services that they may just want to contract with this provider in the future. Especially for something like ABA, where some managed care plans only have 1 or 2 agencies that they contract with, and they're about to see this giant influx of new patients who are transitioning to managed care. You may just want to ask them if they're willing to contract with the agency indefinitely. I don't know what they'll say, but it's worth trying, especially if what you're seeing is that they don't have the capacity to provide these services to everybody who needs them. They're going to have to take on additional providers somehow. Right. So that is also a potential avenue.
And that might be a situation that a lot of people are in right now if they did have fee-for-service Medi-Cal transitioning into the managed care plan.
Yeah, because if you had a child before if you have a child who does not have an autism diagnosis, but they need ABA, often the private insurance companies will deny it because they don't have an autism diagnosis. And then if fee-for-service was their secondary Medi-Cal, then the regional center is the contracted provider for ABA for children who have fee-for-service Medi-Cal, and they will provide ABA regardless of diagnosis. The managed care plans will also provide ABA regardless of diagnosis. But so if you were in that position, then you were getting your ABA through the regional center. And now the managed care plans are going to want you to transition and find enough providers to cover all that. That's where the continuity of care agreement can come in. But again, like you may also just want to see if they'll contract with them indefinitely.
Yeah. So, if
So the same term means two different things depending on who you're speaking to.
Right.
Yeah.
Right.
As usual with public benefits and private benefits and everything, like it's a challenge.
Yeah.
Yeah.
Yeah. And the continuity
There are terms of
care
art and
it's an option that sounds overwhelming to a lot of parents, but it is an option, especially, you know, when you are, again, all of this is about trying to get our kids what they need and really knowing what those options are on the table. And, you know, with PPO, obviously, Leslie, there's, you know, with a private plan, you know, you have more options if you want to see somebody, right? You know, and you want to, and you
Not
might be
always.
paying out of pocket.
Not always. Sometimes the private plans have a really, really narrow provider list.
Yeah, right. And so
Because people don't want to accept, the providers don't want to contract with those plans.
right. Yeah.
So they can,
in LA,
you know,
it seems like, yeah, even more so, you know.
right. An advantage of a PPO is you're paying for that choice, but it's, you know, it's not always there, predominantly, but not always there.
Well, why don't you talk a little bit about super bills? Because, you know, if you do have PPO, you want to see an out-of-network provider, you can get a super bill and possibly get partial reimbursement. But I can't tell you how many parents that I talk to, and it's like, I don't even want to try to get money back. I don't, you know, how do I get my head around this? And, you know, and they're leaving, you know, possible, you know, money on the table. So can you explain really what a super bill is and how it can be used?
Sure. It's a great question. In short, a super bill is more than a paid invoice. It's an invoice that shows you paid the services, but it includes specific medical information in order for it to be acceptable as a medical document by the health plan. It has to have a billing code. It has to have a diagnosis code. It needs certain specific identifying information for the provider, and it needs your child's full legal name the way it is on your health plan card. I've seen claims for a little boy named Max denied because his actual name was Maximilian. The plan rejected it. So no nicknames on your super bills. It's not just a receipt, it's a document that's acceptable by the health plan. Two cautionary items. One is that super bills must be submitted to the health plan before the timely filing limit expires. For some plans, that can be as little as 3 to 6 months after the date of service. For other plans, it can be more like 12 months or 18 months. You have to get them in timely. And also you have to remember that a claim can be paid, processed, and paid, but not paid to you. Before the claims get paid to you, they accumulate to that out of network deductible. And on some plans, that can be a really steep hill to climb.
Yeah.
And let's see. Also, Medi-Cal is never going to accept a super bill from you, right? You have to use an in-network Medi-Cal provider to use your Medi-Cal benefit. And in that case, the provider will be submitting to Medi-Cal. There's no member submissions, no out-of-network benefit, as Lisa said earlier with Medi-Cal.
Right. So now, Lisa, I want to sort of transition for regional center, pre and post 3, right? When we're talking about, you know, what regional center is going to cover therapies.
Yeah.
So if a toddler's getting therapies through regional center, will the regional center keep paying for their therapies after they turn 3?
No, the early intervention services end the day the child turns 3. The regional center should have, before the child turned 3, should have participated in the transitional IEP process to transition the child's case to the school district. Some children will remain eligible for regional center after age 3, some will not. But the regional center services change once the child turns 3, and those therapies, because the therapies are being provided under the IDA, the responsibility for those therapies transitions to the school district at age 3. However, if you have Medi-Cal, you may still be able to get those medically necessary PTOT speech services through Medi-Cal. And the waiver that allows children to access Medi-Cal if they're regional center clients, for most children, that will the eligibility will start at age 3. There are some exceptions for children with a diagnosis of developmental disability and who have significant medical care needs. Some of those children may be able to enroll in the waiver before age 3. But typically they'll be eligible at age 3. And so even though the regional center is not going to be providing those therapy services anymore, they may at that point be providing access to Medi-Cal for children who possibly didn't qualify for it before.
Just for clarification, if a child's in private school, do they have any options, right? Is a private school going to pick up any therapies during school? Like when a child transitions into public school, right? The school is still going to be responsible for certain things. How do you, because
that is more of an IEP special ed question, and that is not my specialty. There are certain things that the school district still needs to provide. You can still have an IEP, I believe, and attend private school, but depending on your situation, there are different ways that children wind up in private school if they have an IEP, and that may have happened through due process. That may have happened because they unilaterally withdrew their children and put them in a private school. There are a variety of reasons, and so I can't really speak to exactly what would happen. But that's a question that I would ordinarily defer to our education specialist.
Exactly, right.
However, again, if your child has private insurance and has Medi-Cal, you may still have access to some of those services through insurance. And some private schools may be willing, if you have private ABA, some private schools may be willing to allow that ABA therapist to come on campus and provide those ABA services in that setting. So it really just all depends on the school, and some schools have therapists embedded in their programs.
Completely depends. I also wanted to walk through a common scenario around a non-therapy issue. So let's take incontinence supplies. That's something that, we see from a lot of our families. So if a family has private insurance, Medi-Cal and regional center, how would funding work to get incontinence supplies covered? Leslie?
If your plan covers incontinence supplies, you're going to need a prescription from your child's doctor detailing the size and the brand and quantity that's needed on a monthly basis. You can then contact your insurance company and ask them for a list of providers under the category of DME, durable medical equipment. And sometimes the incontinence supply benefit falls under a subheading under DME of expendables. If your plan tells you that there is no benefit for incontinence supplies, you want them to put that in writing to you, or you download a summary of benefits that's on the website. Once you have a piece of paper that says that it is not a covered benefit on the plan, you can take that piece of paper to Medi-Cal. That would be your next stop.
So again, it's that funding order of operations. And then Lisa, when or would regional center fit into this scenario?
So I want to add to that for Medi-Cal. For that denial, the denial has to be for every part of that incontinence supply. So not just diapers, but disposable underpads, they call them chucks. Also barrier cream, like if you need diaper cream, the Medi-Cal will also pay for waterproof mattress covers, I think once or twice a year. But you need your doctor to write the prescription out for each and every one of those things. If you want them to be included in the denial, you want to make sure the denial lists each and every one of those things as not covered benefits. And then you take that denial letter plus the prescription to a provider that contracts with your Medi-Cal plan. They need a copy of that written denial from your private insurance, and then they can provide those things to you. So the regional center is going to come in 2 situations. One, under 3, if there's financial hardship, And that's something that you really have to talk to your service coordinator about. The main area where, and after age 3, the main area where regional center can come in is a lot of our kids, especially if they have a lot of medical complexities, may have allergies to the diapers that Medi-Cal uses. They may have sensitive skin. The diapers may not be adequate. They may not provide adequate coverage. And then you may be in situations where the child cannot go out in the community and be independent because their diapers are leaking. There's not, sometimes kids have structural differences and maybe their body is a different proportion and the diapers just don't fit them. There are a variety of different reasons why the Medi-Cal diapers may not work. And the providers who provide Medi-Cal diapers may not have any other brands. So you would need to document that. You would need to show that you tried the Medi-Cal brands. You need to show that you tried to find another provider who had different brands. And you need to have something from your doctor saying that it's medically necessary, that they need diapers and that they need to be a certain brand or that they need to not be a certain brand. You can take that to the regional center. And they can often provide either vouchers for diapers or reimbursement after the fact. And if you go the reimbursement route, you have to fill out some vendor paperwork to become a parent vendor through the regional center so that you can receive checks from them.
Right.
And every month. Say that again.
I'm just repeating, like documentation, medical necessity, right? I mean, like
and then you'll have to
get it all.
And then you'll have to submit those receipts to the regional center every month, and that service will have to be reauthorized every year. You may need another letter from them at some point. And with the diapers for Medi-Cal, you're going to need a new denial every 12 months. Right. So it helps to mark on your calendar at 10 months to reach out to your insurance company and let them know you need another denial. And different insurance companies handle this differently. Like I know with Kaiser, you call member services. If you know your plan doesn't include incontinence supplies, you call member services, you say, I need a letter explaining that it's not a covered benefit, and they'll send you the denial letter. In other
They're happy
other
to
plans
tell
might
you.
have different. I know, right?
They're happy to tell you they're not going to pay. And another
but you do need that prescription too.
Right. And another reason to establish funding for a specific diaper is skin breakdown. For children who have limited mobility, sitting in a wet or soiled diaper can lead to skin breakdown. And if there's any kind of immune issues, that's all something that the funders will take a look at.
Right. So we've sort of touched on appeals throughout, but wanted to kind of wrap things up. I mean, if appeals could be an entire event in itself, obviously, but Lisa, if you could just start us out and quickly tell us like what parents can do if they want to appeal a Medi-Cal Regional Center or CCS decision.
Okay. So regional center has a specific appeal process. You basically, anytime you get a notice of action, which is a notice from an agency that tells you what they're deciding or what they're terminating or what they're rejecting, what they're not going to grant, it should also come with a form to fill out to file an appeal. You can also often do those online, and it should include a web address to file those appeals online. If you're in a managed care plan, then you need to file a grievance with your plan first. You can do that with a phone call. You do not have to submit an appeal to a grievance to the plan in writing. That process is supposed to be easy. And so you should be able to call member services and let them know it's supposed to be easy. You want to file a grievance. If you don't hear anything in the next week or two, you may want to call and make sure that they have it and that it was in fact filed. So if you want to file for a state hearing for Medi-Cal, you need to show that you've exhausted your appeal rights within the managed care plan. Again, I will reiterate, sometimes the answer is going to be no, but don't be afraid to say why not to the first no, because a lot of times if you question, if you push, if you ask for the policy in writing, if you file an appeal, plenty of times you're going to lose, but plenty of times you're not. And plenty of times you'll be able to get for your child what they need by not taking that first no as the final no.
They really count on people to take
They do.
that first no. I mean, and I'm sure again, there's not a person in this room that doesn't understand that, very intimately. And I mean, Leslie, obviously sorry.
Can I just add one more thing? With the regional center, If the denial wasn't in writing, it didn't happen. Like if you
Like with
ask for
everything, right?
like with everything.
Yeah.
If you ask for something and they say, no, we don't do that, that's not a denial. That's not, I mean, technically you haven't even asked for it. If you have like, you ask for something, they say, no, that's not something that we do, especially with the regional center. The response to that is, okay, can you send me a copy of the regional center policy that says that you don't do that? Sometimes they will send you that copy of that policy, and sometimes they'll say, oops, turns out I was wrong. We do that. So if they're denying something, they need to send you a written notice. And if they say, no, we're not going to do this, you can also write back and say, okay, can you provide me with a written notice of action? And you're entitled to that. And then you can follow up with an appeal and go about that route. But if it's just an exchange on the phone, hey, can I get this? No, we don't do that. That is not a denial.
Right. Same goes, which, we're not talking about today, but IHSS, IEPs, anything else, right? Somebody just saying, we don't do that. It's like, great, let me see the policy.
That's not, you can't,
As much as they think that that's how it works, it's not.
I mean, let's just put it this way. It is them denying you something, but it's not what they're supposed to do. Right. And you want them to do what they're supposed to do.
Well,
and you want them to do the thing that you can then take the next step with.
I was just going to say, right? You need that in writing so then you can continue the process.
That's why those higher level of appeals exist. They exist for people to be able to use them. So to piggyback on your point, the first no, not only is the first no not the last no, but there's a mechanism to keep going. And as you get a no, you can address the reason for that no, and you can sort of move on up the chain.
And sometimes it's going to stay no.
And sometimes it's
but sometimes it's not.
Absolutely. But and Leslie, did you want to, obviously every insurance plan is different, but I'd love for you to touch on just denials and appeals for private.
Sure. There are some constants in this area. Every health plan has, every PPO health plan has 2 levels of appeal at the plan level. You ask for something, they say no, you say yes, but, and then if you get another no, if you get 2 no's from the health plan, you can go to a higher level of appeal, which will either be the DMHC, the Department of Managed Healthcare, where you'll actually get to be able to talk to an attorney, or the Department of Insurance, or sometimes it's just an independent review board. It's a third party, Maximus Federal, or they have a bunch of different names. Your plan will be able to tell you which entity is responsible for your higher level of appeal. It's nothing you have control over. It has to do with the type of plan that you have. And that information is also written in those pages nobody ever looks at, that come in the mail with your EOB, with your claim. There's 6 or 7 pages, but in there will often be exactly where your higher level of appeal is. Or you can find it online.
Right. And we know how just hearing the word appeal makes me like break out in like a sweat, because we've all been there, and it is stressful, but to know at least what the options are, and to get help when you need it.
And if you have a solid argument that's founded in fact and backed up with documentation, and isn't just what you'd prefer, but what your child is entitled to, or what the doctor says they need to have, that's a good basis for an appeal.